Welcome to Patient Matters, where we dive deep into the world of plastic surgery. I'm your host, Dr. James Southwell Keeley. In this series, we will engage in candid conversations with patients, specialist doctors, nurses, and others who have shaped this journey. Together, we will explore the realities of plastic surgery, covering everything from safe practices and patient recovery stories to the latest techniques and the artistry behind the craft. We'll also discuss governing bodies, address botched and revision surgeries, as well as share simulated consultations, all aimed at guiding you through your own plastic surgery journey. With decades of experience, I'm proud to be a member of ASPS and the Royal Australasian College of Surgeons. I serve as a plastic surgeon at St Vincent's Hospital in Sydney. Join us as we unravel the complexities and beauty of plastic surgery, one episode at a time. Now to the Q&A part of our podcast. So the first question that's come in concerns operating environment. So why is that important? A proper hospital has hygiene standards that are enforced by multiple levels of nursing care within that environment. So at the very basic level, you'll have less infection risk if you have your operation in an accredited hospital, in a proper hospital environment.
Okay, well, I mean, this is the thing, isn't it? You can still get infections and things, and when you're at your most vulnerable or your immune system, in the case of a cancer patient, say their immune system's already sort of at rock bottom. So this is when a really clean, sterile environment really matters. It matters the most. So if you're cutting corners and going somewhere to try and save some money, I mean, this is another potential risk that could come back and, lead you down an even longer protracted recovery. So this is really crucially important, isn't it?
It's 100%, yeah. All of these measures to cut back on infection risk cost money.
Yeah.
So you cut corners, you go for the cheapest option, and it's done in an accredited facility, you're more likely to have problems.
Yeah.
So yeah, look, that's just fundamental. And your plastic surgeon, if they are accredited with the Royal Australasian College of Surgeons and ASPS, Australian Society of Plastic Surgeons, we all operate in accredited facilities. So that's number one, I think. That's number one.
So this is also like a relationship that you would have within the hospital as well, because you have a working relationship with these people. So this is another level of the care, I guess.
100%. It's like the invisible care. You don't know what's going on in the background, but the sterilisation equipment is up to the best standards internationally. You've got infection control nurses who monitor infection rates around the ward. They're swabbing inanimate objects, making sure there's no bacteria here or in the flowers there. It is next level. And then you have all the cleaning staff that keep things impeccably clean. So that's what you get when you're
So your relationships with the hospital staff is super important as well.
100%.
Like this is,
Yeah. It's a whole team.
Oh my gosh, it's really quite a lot, isn't it? From start to finish, this is a really big journey. It all matters, doesn't it? Yeah. Okay.
Now, speaking of questions, our next question pertains to surgical plan. So what is the surgical plan? Why is it important? Well, surgical plan is important because no two people are the same. So you really have to individualise your treatment options, your operative planning for that individual, if you're hoping to get the best possible outcome for that patient.
Okay, so this is taking into consideration the things that they've told you and things, again, that you've gleaned, like how healthy they are, their diet as well. Do you sort of, if someone's coming in and they're a little bit, we've touched on this before about the weight, then do you sort of like recommend, do you recommend a dietitian? I mean...
100%, yeah. So it depends on what the problem is and how urgent it is and what factors are modifiable, and then you just optimize the ones that you can't change, and you change the things that you can. Yeah. And if you can possibly defer, you defer. And if you can't defer, then it's a cancer operation, well, you have to modify your plan to maximize your success. You can't just say, well, everyone's getting the same operation because that's what I do. You really have to have a whole bag of tricks that you can draw down upon to choose the right thing for the right person.
So if someone's a heavy smoker or drinker that comes in and they sort of let you know that, then how you've got to sort of, I guess, try and, change their lifestyle patterns as well. That's kind of a bit of a tricky one to sort of, how do you say that to somebody? How do you say you've got to tone it down or you're not going to get the result that you want?
Well, there's discussions I have every day, and ultimately, if it's a discretionary operation, it's just one you're choosing to have rather than you need to have. I won't do it. I won't do it. I'd rather not have the hassle and the heartache and the emotional pain that we'll both share in nursing you through a bad wound healing environment or a failed operation because we couldn't modify, we weren't prepared to change the changeable preoperatively. But there's some patients that say they've got this horrible cancer, they have to have the operation and they've smoked up to the day of surgery.
Yeah.
So sometimes your hand is forced, but you modify, you maximise that safety. You're not necessarily going for that AAA plus result. You say, well, all we can achieve today is the C result. Mm-hmm. It'll be safe. It'll get you over the line.
Yeah.
And then once you're healed up and we can modify those things, then we can revisit and we can improve upon. But really, today is just about dealing with the problem in front of us. No bells and whistles, just the basic, get you healed, get you safe, keep you safe.
Yep. Yeah. Okay. So then you would revisit, I guess, post-operatively to see how they're travelling and...
Yeah, totally. Yeah. And it's a therapeutic relationship. These people, I'll end up knowing for a significant portion of their life, potentially.
Yeah.
And so they keep coming back, and if they're invested in the process, then we walk that line together. We say, okay, well, we're not ready this year. Let's get through the Christmas crazy period, and then next year let's turn over a new leaf. And
so you're planning it really every step of the way.
That's right. Yeah. And some operations are just one-off. That's it. You're done. I'm here if you need me, and I never see them again.
Yeah.
Not after the initial follow-up period. Now others are much more complicated.
Yeah, I feel like everything would be very considered, though. I don't feel like you would just do those ones, and it just, there's always the emotions and things that you have to
even
consider.
The simple ones.
I'm not that simple.
Complexity.
Yeah, I know. I'm really shocked by how much I've learned. You know what I mean? Like I consider myself fairly well read, but the levels of care and everybody's part in it is really quite mind-blowing. It really is. So,
absolutely.
I've learnt a lot, that's for sure. So
I
think this is the thing, to make informed choices, isn't it?
Yeah, 100%.
So,
and the more we can just open up and share this knowledge, the better it'll be for everyone faced with making these sort of decisions.
Yeah. And they're big decisions as well. So, okay.
So the last question to come in from our patients was about patient expectations and how I manage that, essentially. And that's fundamental to the patient-doctor relationship. You can't promise the world and not deliver. You really have to work through that decision-making process with the patient, and all the while explain to them that where we're hoping to get to is here because of these following reasons. It's to do with the way you're put together, your body shape, fatty distribution, it's the comorbidities that you have the diabetes, the smoking, the etc. And therefore, this is where we can hope to get to. And the patient might say, but I wanted to get to this point. This is the photo of my friend who's had this operation. So, well, the operation carries the same name, but the expected outcomes have to be different because that's them and this is you.
Yeah.
And if we can modify and improve upon some of those things, then we should do that preoperatively. And then we can maybe get closer to where you're hoping to. So it's a process of engagement. It's a process of discussion. It's not something that happens in one consultation. And you work through that together. You do what you can to make things as close to their outcome as you can by modifying the modifiable. But ultimately, you just have to educate. And if I think at the end of it all, we're just completely on different pages here, I'll say I think you need to see someone else.
So you will defer that if you feel like it's absolutely you're not meeting in the middle. Yeah.
With dealing with someone who has had something done that they're not happy with, and touch wood, it doesn't happen a lot in my practice. Not to say it doesn't happen, but I see it as secondary consults. So they've had something done somewhere else.
Yeah.
And you just have to come unpacking all of that and trying to work through that. It's really hard.
So that's quite tricky, isn't it?
It is super tricky. I'd rather not find myself in that position. And look, years of practice, now decades of practice, help you with that. And you're better at saying no.
Yeah.
You're just better at saying, this is not something I can achieve for you. And if I think it's realistic, I'll say, these are some great people who work in that space. why don't you go and check out what they have to say? Or I'll say just outright, I just don't think this is achievable. No one does elf ears in Australia, so what are we going to do here?
Absolutely.
Yeah.
So
I'm sure you could find somewhere that did that.
But it's just not going to be me.
It's not going to be me.
So the thing that I've taken away from this is that it's incredibly tailored to each person. I kind of think I came into this thinking that it was almost like, if you don't mind me saying, like a bit like a sausage factory, the whole industry, where it was just like no one cared, they took your money, no one was calling you back, things could go pear-shaped. But actually, if you do your research and you speak to your friends and someone that's gone on this sort of journey, I guess, and they're really happy with it, then you can have the same outcome. And that's why I guess it's really crucially important to get the right surgeon, because you can't put the genie back in the bottle.
Correct.
You know?
I'll correct you on one word there. You said same outcome. Similar outcome.
Similar.
Because it's always bespoke. It's bespoke to you.
Yeah.
You're taller, your chest is wider, your shoulders are wider. That same implant for your friend that looked great on them, it's not going to work for you. You need to do this, that, or the other thing. And then you'll have a similar outcome.
Yeah.
Yeah.
Well, that's your impartiality, isn't it? Because you can see,
you
know, when someone's coming in.
And look, it's often not just this one is the one for you. This is a range of implants, to use the same analogy, that will work for you. And you have a sort of a size range from X to Y, not this is the one.
Yeah.
So your sausage factories do exist. They're not run by plastic surgeons.
Yeah.
They're these cosmetic cowboys. You don't get the care. You're given a choice of 2 implants or maybe 3 because they order in bulk. It's cheaper. At every level, the cost is cut. The outcomes are terrible.
That is just frightening, honestly.
This episode was researched, produced and directed by Michael Hennessy. Filming, recording and post-production by Wombat. Photography and lighting by Francisca Rauenhoff. Hair and makeup by JJ Rauenhoff. If you are thinking about undergoing plastic surgery, please make sure to consult with a qualified plastic surgeon. You can listen to more Patient Matter episodes on YouTube or follow the links on the Dr. JSK website. Thank you again for tuning in. I'm your host, Dr. James Southwell Keeley.